to Dynamic Living, the Total You, with our episode and segment on In Focus, Lifestyle Medicine. Dynamic Living has always been, through the years, trying to search, giving our viewers certain options in order for them to choose from, so that they would be able to have that optimum well-being that they are searching for. And so today with Dynamic Living here, we are actually very much honored to have with us a lifestyle medicine practitioner, Dr. Johan Maniez. Magandang araw sa iyo, Doc.
Magandang araw po.
Okay. Now, ano po, or what are the kind of illnesses that usually come to see you?
Medyo broad po, kasi patients come to us sometimes from pediatrics, sometimes mothers who want to become pregnant. Okay, we also have, the majority, however, is from a group called patients with non-communicable diseases or chronic diseases. The focus of lifestyle medicine is really to prevent, arrest, and even reverse some of these chronic diseases na noon po sinasabi po natin na ay hindi na yan marireverse once na meron ka ng ganyang condition dahil degenerative siya habang tumatanda, lumalala. Na tuklasan po natin sa research na hindi na po yun totoo. There are factors that you can actually change, for example, in your lifestyle, like the type of food that you eat, yung exercise routine po natin, etc., that actually affect the disease process.
I like what you said, arrest, prevent, and reverse. So parang, yeah, so yung tatlong yun something to think about. When you say arrest, these are diseases wherein instead of it progressing, matitigil natin.
Yes.
When you say prevent, hindi natin siya ipapatuloy pa kung ano man. Reversal is there is already the disease process, and yet you can do something about it.
Yes.
Okay?
Absolutely.
So you're talking about the chronic diseases, which are usually ano-ano ito mga da?
Number one killer natin, syempre yung heart disease po, and related cardiovascular diseases. So katulad ng stroke, heart attack, yan po ang mga main killers natin sa society. Pero hindi lang po yun, yung iba pong mga chronic diseases po natin, katulad ng diabetes, hypertension, okay? Ito po ay mga chronic conditions rin, arthritis, yan. So lahat po itong mga chronic diseases na ito, ina-address po natin sa lifestyle management.
Okay. So why are patients seeing you? In other words, they already have doctors, di ba? Most of them are sometimes being handled by 3 or 4 specialists.
Yeah.
So why would they see you? Do they get to see you firsthand because they hear that there's a lifestyle medicine practicing doctor? Or are they also being referred to you by our colleagues from the different specialties?
Yeah. I do get a few referrals, I wouldn't even say enough, but most of them, usually they just find out about lifestyle medicine online while they are researching for something that can be more useful for them as a person with a chronic condition. So minsan po nag-give up na po kasi yung mga physician sa kanila na ay ano na yan, wala na tayong magagawa dyan kasi diabetic ka. So panghabang buhay na yan na condition. And then they find out na ay pwede palang ma-reverse on that type 2 diabetes in particular. Kasi meron na po tayong bagong mga findings. And so they end up looking for me. They end up calling my number or emailing me or using Facebook to reach out to me.
What is the concept of health and disease in your practice, Doc Johan?
Lifestyle management, lifestyle medicine, what we do is we focus on, instead of the symptoms, di ba po, usually symptomatic care po tayo sa adult diseases. Ang ginagawa po natin sa lifestyle medicine is we focus on the cause of the disease. So we know that there are certain risk factors that are present for certain patients. So we focus on those risk factors, and once we take away the risk factors, the causes of diseases, then the disease is allowed to, the person is allowed to heal himself or herself, because we do have an innate capacity to do this.
So in your actual practice now, Doc, would you say that you are seeing an increasing number of patients looking for you, seeing you because they feel na you have something to offer them more than what they are going through right now?
I I can't really speak for them, but when I get them, and when I get my patients, I usually ask them, how did you learn about me? Because I do want to know, you know.
Yes.
And most of them will just say either, oh, I found you online, or someone or your patient told me that he got well from his diabetes. He is now diabetes free. He doesn't have heart disease anymore. His arthritis is gone. Then of course that kind of inspires them and say, okay, I think I need to try this, doctor. So usually po ganun ang mga
Have you
natatanggap
seen an
natin.
increase in the number of patients that you get to see?
Oh yeah,
Like when
definitely.
2011, when you started, was it 2011 that you started?
2010, 2011.
Yeah,
around
so
that time.
from that time up to today, 2019, would you be able to say that you have quite a number in increase in the number of cases that you are now seeing and managing?
Thankfully, yes.
Because that's going to be
So,
the gauge,
yeah.
Doc, na kumbaga, these patients that you started to treat and to manage are the patients who would be telling others and who would want to share the good news that they have for them, for their healing, and so they bring them to you by word of mouth. And so if you have an increasing number of this kind of patients, that only means that you are effective in what you're doing.
Oh, I guess that is the interpretation.
Okay. Yeah, that's how it is. Why do you think that Filipinos particularly have an increase in the incidence of these chronic diseases or chronic disorders? In your own way of looking at our culture, na how come we Filipinos seem to have, you know, continually increased in the number of cases for chronic non-communicable diseases?
We have created a culture for ourselves, sort of fused the Western culture with our Filipino traditional culture, and because of that po, I think Filipinos have adapted, for example, the Western type diet. Hindi lang po yung Western diet, pero linagyan pa nila ng additional na Filipino zing to whatever.
Na sobrang madaming,
Yeah.
kumbaga, patis,
Sakto
toyo,
po.
asin.
So parang hindi na nga po healthy yung yung Western na diet. Tapos dinagdagan pa po natin. Kaya makikita po natin yung taas ngayon ng rates ng lahat po ng mga chronic diseases. It is simply skyrocketing. In fact, in terms of death rate po, no mortality rate, 70% of all deaths in the world are because of chronic disease. This is from the 2017 WHO report. And we look at the DOH report and we find that we are at par with the rest of the world. So 70% of Filipinos are dying because of non-communicable diseases. And we know that these diseases are completely preventable.
Yes, yun yung gusto kong marinig sa iyo na these chronic non-communicable diseases are preventable, di ba?
Completely.
So we'll
It's
take a
not
very short break, Doc. And
Okay,
then
sure.
medyo mainit na yung aming pag-uusap dito, no? So please stay tuned to Hope Channel. We'll return in a very short while. Welcome back to Dynamic Living the Total You with our episode In Focus, Lifestyle Medicine with Dr. Johan Maniez. Doc, meron kami mention before we took a break, prevention, preventable. So, pag sinabi mong preventable, would you say na marami kayang mga tao ngayon, do they know, do they understand that the diseases that they may have are something that they could have avoided if they did, you know, if they went into the prevention mode first of all?
Yeah. Meron kasi tayong concept na na genetic yung mga conditions na to, yung mga non-communicable diseases. But we know for a fact that what we get from our parents are not just their genes or their DNA, yung genetics nila. We also get the recipes of our parents. So usually whatever our parents eat, we eat. You know, the type of lifestyle they live, we tend to reflect that also. And because of that, since our parents may have an unhealthy lifestyle, if we adapt that, then we're basically learning how to create disease. So ang ginagawa po natin sa lifestyle medicine is we educate patients to, if they don't have a disease yet and they have the risk factors, then we educate them to adapt a different lifestyle so that they can break that chain. You see, we have a saying in lifestyle medicine: genetics loads the gun, lifestyle pulls the trigger. So hindi ka mamamatay dahil dun sa genetics mo unless you live a very unhealthy lifestyle that actually triggers the on switch of these genes to manifest. So we have
we have what we call, kasi diba in medicine, you're a medical doctor, by the way, right?
Yes,
So
I am.
we already know that, of course, aside from genetics, we have environmental factors.
Yes.
And it actually plays a major role in what we are having
role.
right now, right? But let me ask you, Doc, why did you choose lifestyle medicine over any conventional medicine practice?
Actually, I didn't begin as a lifestyle medicine practitioner. I started my career, supposed to be career, in internal medicine. So I was in residency for about a year, and it was there that I realized that it wasn't going to work for me, because what I signed up for was I would say a profession that actually helps people get better. But in my experience as a resident was that the patient's diabetes, the patient's hypertension, their heart disease, their different chronic diseases, they never actually go away. You just have to keep adding medication to sort of control the symptoms, yung mga simptomas lang. Pero yung disease mismo, hindi...
The root cause of it.
Yung mismong sakit, hindi na-address. So there came a time where I was so frustrated, I was literally depressed, you know? And I said, maybe this isn't the path that I should take. And there were a lot of signs. I kept praying until one day, you know, my performance was not very well anymore, and I felt every time I went into the hospital that there was a dark cloud surrounding me. So I was literally depressed. You know, if you diagnose me, I would probably have some type of depression. And so eventually I had to quit. I said, this is not for me.
And so you went into lifestyle
And
medicine.
I was searching for the truth, and I was searching for something that would give me fulfillment as a physician, to actually see people get better. And I found out about lifestyle medicine. Yes.
And is it a 4-year duration in training, just like, you know, internal medicine, you have 3 years for it, and then you go into subspecialization. In lifestyle medicine, is it the same thing also?
Yeah, it's now it is the same thing. When I entered into lifestyle medicine, we were kind of the trailblazers. So nobody really knew what lifestyle medicine was. I happened to be one of the first international fellows of lifestyle medicine of the American College of Lifestyle Medicine. And lifestyle medicine essentially started from the US and Australia. So there
How
wasn't...
many of you are practicing lifestyle medicine doctors here in the Philippines?
Here in the Philippines, close to 140, 150 at present.
At present. So
Yes.
maliit pa rin. But then there's
Konti pa
enough
lang.
number. Yes.
Yes.
Okay. So now let's talk about what are the services that you offer in your clinic. Like for example, when the patient would come in and see you, what are the things that you would do to your patients first?
The basics, of course,
Yes.
medical interview, physical examination if required, if needed. Usually I get patients who have already undergone this interview. They even have laboratories already. They've probably been admitted several times to the hospital, and they have their regimen of medications, you know. And literally they are giving up on the system because the system basically
work
doesn't
for
have
them.
any answers for them. And their condition is just getting worse and worse. And then of course we have complications and the effects of the medications when it accumulates. So all of these things basically pushes the individual to look and search for something that will actually help
So
him or her.
when they see you, how long does it take for you to be able to see one patient? And do you develop a program plan right there and then? Or would you say that the patient has to go through the diagnostics first to make sure that when you give and introduce these things, they would be, at least you are now trying to complement what the patient has?
Yeah. So I would say around 10 to 15% of my patients come in for the first time. But the rest, they usually already have had experiences with other physicians. So they come to me with all their medications, all their laboratory results. So I don't really have to order as much laboratory diagnostics, for example. And from there, I ask the patient, look, what we do is we manage your lifestyle. We teach you, we educate you. And at the beginning, we want you to work very closely with your own doctors. Kasi po, dapat alam po ng physicians nila that they're undergoing our programs because the changes can be drastic. So we've had diabetics, for example, within 3 months, their doctors are panicking. Why is their blood sugar so low? They had to pull them out of their insulin, out of their hypoglycemic medications, for example. And literally, the reversal of the disease is quite dramatic that the physicians have to closely monitor their patients. Otherwise, the side effects of the medications may be increased with that patient, and side effects aren't very good.
So in other words, you are actually there not to have the patients remove their current medications that they are having from their doctors, but rather you are trying to help them out with the way their lifestyle itself.
Yeah.
When you talk about lifestyle, Doc, you're talking about diet, you're talking about exercise, you're talking about what they're going to eat and not eat.
So let's show you an imaginary pie chart. Around 35 to 45% of what we teach our patients is about diet. We know based on the experts such as Dr. Stanley Kahn, Dr. Friedrich Steyer of the Harvard School of Public Health. These are major experts in epidemiologic research concerning nutrition, and they say nutrition is the single most important environmental factor affecting health. 35 to 45% affects your health. So that nutrition is a big part. Then of course smoking is another huge chunk. So we have to educate patients a lot on nutrition, and most of our training as lifestyle medicine physicians is on clinical nutrition. So we specifically prescribe certain foods for certain conditions, etc.
So
and
you mean, Doc, that not all kinds of diet will be applicable to all patients. So it has to be, very specific for a very particular condition. Before you answer that, we'll take a very short break, and when we return, we'll answer this one. So please stay tuned to Hope Channel. Welcome back to Dynamic Living the Total You with our episode here, In Focus, Lifestyle Medicine with Dr. Johan Maniez. Doc, ngayon sagutin mo yung tinanong ko sa inyo. Kung heto bang mga diet na to ay very specific for a particular person or disease condition, or heto ba ay pangkalahatan?
So meron po tayong general po na diet. Ano po? We based it po sa research, based on evidence. More than 40 years of evidence po shows us na ang pinaka-best po na diet for the human being. So, naintindihan po natin, iba't iba pong species ng hayop may kanya-kanyang diet. Ano po? Ang humans, meron rin po tayong diet based po dun sa research na natuklasan po natin sa research. And based on the research po, what human beings should be eating is a whole food, plant-based diet, period.
Okay, pero heto ngayon, ang tanong ko sa iyo how do your patients embrace this turnaround or change in the way they perceive their nutrition or their diet?
Again, education is the key. Ano po? So, kailangan po natin turuan yung mga pasyente po natin kung bakit kailangan po nilang i-embrace ito pong bagong lifestyle na tinuturo po natin, lalo na po yung diet.
Okay. Now, heto Doc, in terms of success or failure, what would determine the success of the program that you have for a particular person with a certain type of disease? Say, for example, hypertension, o kaya naman arthritis, di ba? O kaya naman diabetes mellitus. Heto po sila what would determine whether the treatment plan or the managed plan plan that you have will succeed for this particular patient and would fail in another person. Kasi even in evidence-based medicine, all of us are evidence-based medicine practitioners. Even in conventional, traditional way of treating patients, there are success rates and there are also failure rates. So sa inyo po, sa practice niyo, what would determine that one?
Marami pong factors. Tulad po ng sabi ninyo, number one na po yun, doon ay yung compliance. So kapag nasunod po nung patient yung mga programs, yung protocol na binibigay po namin, anong dapat kainin, ilan dapat minutes of exercise a day ang kailangan, tulog sa gabi, inom ng tubig. Pag nasunod po niya lahat ng principles na tinuturo po natin, usually po gumagaling yung patient.
Ano po yung timeline before a person or a patient would see a difference in the way they feel, in the way their laboratory workups now will show up in terms of results from the time that they start with you? Like, kasi yung iba, it takes them months. Sometimes it takes them a year before they would start saying, I feel better. I can feel that there's a change in me. So sa inyo po, para sa mga pasyente ninyo?
Diyan po na-excite yung mga patients po, kasi in a matter of days, they already feel the difference. Once na in-apply po nila or in-adapt po nila yung lifestyle, katulad ng mga heart disease patients namin na laging may chest pain, angina, yung parang merong nakadagan na elepante sa dibdib nila na hindi sila makahinga, na na-experience nila, kunyari naglalakad lang sila paakyat ng hagdan. Usually po in a matter of 1 to 2 weeks on the lifestyle na rin-recommend po namin, nawawala po yung angina pain. So, very dramatic po. Tulad nung sabi ko sa inyo kanina, minsan nagkakandara pa yung mga attending physicians nila na i-adjust yung medications kasi mabilis po ang changes po na na-experience nung
So,
pasyente.
let's talk about the challenges in your practice here right now. Would you say na very accepting naman ang mga traditional practitioners with the way you are trying to embrace, and teach the patients on lifestyle changes as a complement to what they have in order to make a patient well? Or do you find a resistance?
With everything that is new, bago po ang lifestyle medicine, although ito po ngayon ay pinakamabilis na it's the fastest growing specialization in the world today po, pinakamabilis na organization or specialization sa medicine. With anything new, may resistance talaga po tayo. So, I've had some doctors call me quacks. I respect them. I respect their opinion, but no, I'm not a quack doctor.
You're a medical doctor,
medical
so that means there's
doctor.
a scientific basis for what
Absolutely.
you do. So, what is your vision in terms of looking forwards? What is your vision for your practice, for your patients, and for the Filipino people as a whole?
I guess my personal vision is shared with the vision of our organization, the Philippine College of Lifestyle Medicine, which is also a reflection of the vision of our global organization, the Lifestyle Medicine Global Alliance, which is a Philippines or a world without chronic disease. Yun po ang vision talaga po natin.
Is it achievable?
I think it will be if all the governments, all the health organizations around the world will rally together, educate the population. Once na mangyari po yun, we will see changes. We're already seeing changes with our patients. How much more on a bigger scale when all this information
now, the
is
Department of Health, we
shared.
know, is the licensing division here in the Philippines in terms
Yes.
of practice. So how are you with your licensing now?
We are in talks with the DOH. In fact, they are excited. We've already had several conferences with DOH physicians, so physicians in the rural areas who are actually handling health centers in the Philippines. So this is something that we are excited about. We've also talked with organizations such as the Philippine Heart Center, for example. So we have colleagues there, cardiologists who are excited about the concept of lifestyle medicine and how it can help our number one killer, which is heart disease.
Yes.
The rates go down. They're waiting for
because
that to
right
happen.
now it is not going down, and we
Yes.
look forward to really having it go down. Doc Johan, how would I say this? Are there also risks or complications to patients when they embrace lifestyle medicine? Because you know for a fact that we as doctors, that sometimes anything that the patient has or is taking in terms of managing the disease process, there is a risk or a complication that may be attached to it.
Lifestyle medicine is a non-drug modality approach. Although the patient may already have drugs on board or medications that have been prescribed by previous physicians, we don't take them away immediately, but our intervention po, yung ginagawa po natin para sa pasyente, non-drug modality po. So, ang mga risk factors or side effects po, usually, kapag kumakain ka ng prutas at gulay, ang mga side effects po, gumaganda yung skin. Yung mga side effects po namin ay medyo nagsislim. So, more positive po yung side effects ng lifestyle management. Hindi po kami masyado nagwo-worry sa side effects kasi nga magaganda
siya. Do you work
siya.
as a team or do you have a team like working with you towards the preparation and in the implementation of your program plan for the patient?
Yes po. Kailangan po may team lagi. The physician can't do everything. We usually have a chef on board kasi siya yung nagtuturo kung paano pasarapin yung food. Meron po tayong nutritionist, may nurses rin po tayo, may physical therapists. Kailangan po talagang team, and during consultations, lalo kapag group consultations, we always have either a psychiatrist or a clinical psychologist on board with us in the group consultations para ma-identify po nila yung mga mental conditions.
And you also advocate wherein the family should be there together.
Oh yeah. We believe the family is the best support group po ng pasyente. Meron kaming mga pasyente na naaawa po kami kasi mag-isa lang siyang pupunta sa amin. Pag meron kaming rene-recommend, pag uwi niya, ang kwento niya sa amin, pag uwi daw niya, kinakantsawan siya, itong pagkain na to, hindi ito para sa'yo, yan lang. Mahirap yung ganun po, hindi maganda yung support system kapag ganun. Samantalang, kung yung pasyente kasama niya sa consultation, yung pamilya niya, yung pamilya po naiintindihan kung ano yung kailangan gawin ng pasyente at kung gaano ka seryoso yung kondisyon niya. And when they understand po, once na maintindihan ng pamilya na, dapat may gagawin rin pala kami, may responsibility pala kami para sa paggaling ng pasyente, ginagawa po nila yon at nasusuportahan.
That is one of the basic things that you need to be able to inform, no? And educate our families and the community as a whole. Thank you, Dr. Johan, for your time. What is your message now to our viewers? Maybe you invite them to see you in your clinic.
Sure. First of all, I'd like to say that there is hope for all these chronic diseases po. So whether meron po kayong heart disease, meron po kayong diabetes, hypertension, even certain types of cancer, we have seen that these conditions can be arrested, hindi na po siya lumalala, na preventionan po siya, at kahit may sakit na po kayo, na ganung mga sakit, pwede po siyang mapagaling, ma-reverse yung condition. So sa ngayon po, hinahanda po natin yung lilipatan natin na clinic. We will be transferring to Makati, hopefully to the end of the year, towards the end of the year. So keep in touch na lang po sa Facebook na lang, at saka po sa ating cell phone numbers na siguro if-flash sa screen
Yes,
natin.
we'll flash them on the screen so that they can get in touch with you. So heto po, no? Anyways, heto po ang ating tandaan. When we really want to resume or to regain the health that we have been aspiring for, then we will always try to embrace anything that is new. But be sure that the new that we are going to embrace is something that is evidence-based, based on evidence-based medicine, something that is not, that is scientific in nature, and something that is doable, as well as very practical, and importantly po, this is approved by our government in terms of licensing. So dito po magtatapos si Dynamic Living the Total You with our episode here in Focus, Lifestyle Medicine. And sabi nga po ng Biblia in Job 33:25-26, let their flesh be renewed like a child's, and let them be restored as in the days of their youth. Magandang araw po sa ating lahat.
Dynamic living, making the best of you on fire. Dynamic
you have been blessed by this program, share hope and help us continue to bring hope everywhere. Send your donations to South Philippine Union Conference through any of the bank details shown here. Hope Channel. Sharing love, changing lives.